Oh, here we go. Now I'm speaking. Mm, okay. I'll wait a few minutes. Hope everybody is doing well, that you guys have had a good week so far. There's a little bit of a glare here. Let me see if I can clean it. It's still there. It's okay. All right. Just give everybody a little bit of time. One. All right. So I wanted to let you guys know for next month, the topic is going to be eat first, then have your cup of coffee. I know that it's a little bit like, what are you talking about? I have coffee first thing in the morning. I don't understand. What are you saying? This doesn't make sense. And trust me, I was the same way. But I'm not anymore. And I think once we have a better understanding of what it does to our bodies, we're more inclined to choose something a little bit like having a meal. So I just want to let you guys know that is going to be the topic for next month's masterclass. Um, so I'm just going to go ahead and just start with a little bit of an introduction. So if you guys know, I am the founder of my practice, Cheers to Health. It's here on my shirt. And I've been a registered nurse for almost 20 years, which is absolutely insane to me. And I am a nutritional therapy practitioner. In my practice, we focus a lot on holistic living when it comes to house products, products that we put on our skin, and really nutrition, proper supplementation, and just really getting to the foundations of health. And so today's topic is about finding your voice. And the reason that I chose this topic is basically after working in healthcare for almost 20 years. I hear this a lot and I still hear a lot now. And I'm noticing the glare is a little bit much. So I do notice, and like I said, I do hear this a lot in not only my practice, but I see it a lot on social media, even in my own family. Especially, like with my uncles who are a lot older and have a lot of health issues, or just even just going to a doctor in general. This is common, just not only in the elderly, but very common in pediatric families. It is very common if you're a primary caregiver and you are not only responsible for your health, but also the health of that individual, whether they have Parkinson's, they have dementia, they have cancer, whatever it is, or they've just been, chronically ill, unfortunately, for majority of their lives. Sorry, let me just put my phone on vibrate because I forgot to do that. Da-da-da-da. Oh, yes. So let me just share this with somebody. Yeah, so I had to change. So I don't really like social media that much, or this whole like Instagram sometimes, not Instagram. It gives me like a little bit of anxiety because I had to copy. So when you set up a masterclass, you actually have to like choose like Streamline or webcam. And let me just give me 1 second. Okay. So when you set up something like this on YouTube, you actually have to select if you are doing like a stream or a webcam. And I must have done a stream. So then I always try to start these classes 15 minutes ahead of time because I like to make sure that number one, it's working. Because the last masterclass that I did, my chat, the live chat was not working. And I was pretty upset about it. So I am just glad that it is working today. So if you guys have questions, please let me know. And that ways, like, see now I'll do testing or we just put hi everyone. There we go. So thankfully, so like I said, it's always been something. I always sweat when I do this, and that's just how it is being a business owner and figuring out how to use YouTube and figuring out how to go live. It's always such a mission. Um, so I feel like I'm just gonna start over again. So for some people who have asked for the link and I just reposted it because I wasn't sure if it was going to like roll over, like if the links were gonna roll over. So I posted that. I know this is like not very professional, but I am very sorry. Uh, so like I said, I've been a nurse for almost 20 years, and finding your voice, like I was saying, is just a very important in for your kids when you're pregnant, basically throughout our entire life. It doesn't really matter kind of what stage you're in. This is very key because a lot of things get missed through the cracks of healthcare. I will be sharing my story as to how I found my voice, even as a nurse and even with education. I do have my bachelor's degree in nursing and I became a mom. My son had eczema. So we went to a phenomenal pediatrician and I bought into the creams, I bought into everything. And again, with my nursing knowledge, I didn't understand. And I was like, okay, well, like what's missing? So, I would ask my questions and then It's not that I wasn't getting shot down, it's just my questions weren't being answered. So I usually, if you're new to my masterclass, I usually do a whole slide presentation, but I really wanted today just to be kind of organic and natural in flow and just to be more of a conversation because something like this, it can be, I don't want to say the word triggering, but it can stir up some emotions, especially I have found in people the ages of like 50 and up. They're very trusting in their medical team, which I understand and I respect that 100%. I do want to make a disclaimer really quickly. Everything that I am saying here, there are amazing providers. There are providers that are going to sit down with you. They're going to listen to you, but the majority of healthcare providers out there, unfortunately, they don't have the time to like sit down with you for an hour to go through your loved one's health history. So, and if you think about the time, like let's say you have kids, right, and you're taking them to their physical, it's probably maybe 10, 15 minutes. Milestones good. Okay, yes. Okay, bye. So what happened in our case was, like I was saying about eczema, and I was, we did the whole cream thing, and my son was maybe almost 3 at the time. And I was like, something is missing. I'm not understanding why he is getting eczema. So then I had to outsource, go to a doula of mine that I very trustworthy. We're still friends to this day, and be like, hey, look, I'm really stumbling with this. My son just, we're not moving the needle with, with his eczema. And I was very frustrated. So she actually pointed me to a holistic pediatrician. And being a nurse, being in healthcare, I was like, holistic what? What does that mean? So, long story short, I went to that person. I went to this doctor, and he was phenomenal. He opened my eyes to eliminating certain foods. So then when I started learning about the body, once I went back to my son's pediatrician, there were certain things that I would decline or be like, okay, do we really need this? And not always saying yes to a prescription medication. Not that I was going against medical advice. I was just thinking more clinically and more in a whole picture form, not just a symptom form. So I still kept my son's pediatrician, but I also would utilize that holistic pediatrician when I needed to. So it was a nice bridge for my son's health. And thankfully his eczema, went away after doing things a more holistic route. So that's how I found my voice. And anytime, and most of you guys know on here that my dad did unfortunately pass away 8 months ago already. So my sister is a nurse as well, and when he was in the hospital, uh, I had a clipboard, and I had all of his lines color coded, all of his medications, all of his procedures, everything that was going on, because I have found, like, if I've had family members go to the hospital, they will text me, "Hey, what is this?" And so the big point, especially if you have somebody that's in and out of the hospital, a loved one a lot, whether it's a chronic illness, it's cancer, it's dementia, Parkinson's, whatever it is, when you get to that hospital and you are that point person, or let's say you're that person that your family has deemed the medical advocate, you want to ask, hey, what labs are you drawing? And, or what medication are you prescribing? And it's not that one is being obnoxious. In today's healthcare system, you need to know what's happening to not only your body, your children's body, and whoever is involved in this medical treatment. So every day, in our case with my dad, we went to the hospital. I looked, and also, just so you guys know, if you do go to the hospital, maybe in some provider's office, you can have an account, and you will be able to see the labs, what tests they've done, if they've been interpreted. That's very common in inpatient admissions. So when my dad was in the hospital, I looked at everything. I read all of the notes from every single provider: infectious disease, nephrology, critical care. I would be involved in the rounds. And not that you might be sitting there, oh, Christina, but you're a nurse. You don't need to have medical knowledge, to do this. It is just that my dad was intubated. So it's our responsibility to be his voice and to say, okay, what's happening? Do we need to do this? Do we need to do that? Just like really staying on top of the stuff. And it is helpful. So that way you're able to understand, okay, are things improving? Are things not improving? What do we need to work on? What do we need to tweak? So that is one part, especially like I said, if you're going to be admitted, that is something that I really do encourage you to do. And yes, it does take us nurses more time to do so, but being having bedside experience, I found it helpful when the families were informed because again, I did pediatrics, so I would explain things to the parents. And again, not every nurse and not every provider practices the same way, but it really should be the standard. And it is helpful as a nurse when a patient and family understands what's going on, because then they're less likely to ask a lot of questions. And it's a very stressful time as it is being in the hospital, not knowing what is going to happen to that loved one or depending on that medical situation. So yes, you see somebody come in, ask what labs have been done, and say, hey, listen, please let me know when the results are happening, what medications are being ordered. And if you don't know what let's say they're ordering a medication you never heard of it before, I'm going to put here in the chat this is a public website. It is not for medical providers. You can look up a medication. It's going to tell you what it's for, side effects, so on and so forth. And that way you're able to understand what they're being treated for and what side effects that medication may have. So that is when it comes related to the hospital setting. And now when we go back to just going to your provider's office, right? A lot of times it is challenging to get into that provider's office. So let's say you've waited months, and I mean, I do hear this a lot too. They were dismissive of me. They talked over me, and I will tell you now that nobody knows your body like you do, right? You know the stress you're under. You know how long you've not been able to sleep well. You know how long you've been feeling bloated. Now, with all the knowledge that a physician has, they have a lot of knowledge. They're very smart people. They don't they don't see that every day for you. So if you find that a provider is being a bit dismissive, you can say, okay, but I'm still feeling this way and I don't feel like we have an answer. So there also, if you're feeling dismissive with a provider, you can fire that provider, meaning that you can part ways with them. And you want to find somebody that is aligned with how you see health, because number one, you want that person to be reliable. So when I was pregnant with my first son, I actually interviewed a couple of pediatricians because I wanted to ensure that they knew about breastfeeding, because if you don't know about breastfeeding, you're likely to encourage formula. So the pediatrician that I did see when they were younger, she knew about breastfeeding. She was amazing. So, and interviewing may sound a little like over the top, but when it comes to the health of your loved ones, there is really, in my opinion, no such thing, because you're putting that trust in that healthcare professional to steer you in the right direction. So if again you feel misaligned, you don't feel heard in that doctor's office, you're feeling dismissed, find somebody else. You're not going to hurt their feelings, and if you do, that's okay. This is about you and your family. And also, I always encourage people to come with questions, especially when I did night shifts. And, let's say somebody got admitted during the nighttime, parents are really tired. And I'm like, hey, look, you can write your questions on, here's a pen and paper, because we're going to forget. So let's say it's time for you guys to go to your provider's office and it's your physical time and whatever you have going on. So you're into endocrinology, you're a new diabetic. Write down, okay, what kind of foods am I going to eat? Just be prepared, because once you see that provider, sometimes we get this like Men in Black, you just don't remember what's happening. And that way you're not leaving the office, because again, what also happens too is that, oh my gosh, I forgot to ask them. And then when you call the doctor's office, you're probably getting the office secretary or the office manager. Then they have to relay that information to the provider. And sometimes you may or may not hear back from them until your next appointment, which might be in a few months from that initial appointment. So come prepared. Like I said, this is your health. This is not a gamble. This is not some game that we're playing with. So you really need to learn how to be an advocate for yourself. Is it easy? No, it's not always comfortable to do, but you're then able to really bridge that gap. You're able to say, okay, well, I see this and you see that. Okay, then you guys can come and form a plan together. Collaborative healthcare is really what we should be striving for our children and for us, because we're going to these doctors for knowledge. We have knowledge too, because especially I just go back to being a parent, you know your kids like the back of your hand. And I always told this to my parents that I cared for. If you see something a little bit off, please let me know. I am meeting your child just for the first time. I don't know them like you do. And again, if you have a physician that is dismissive of that and of you, please find somebody else. Do word of mouth. You can do Google search. You can go to their website. Again, you can interview them. Just so again, they're really aligned with what you believe in, right? At the end of the day. And you can also outsource different providers too. You can have a massage therapist, you can have a holistic practitioner, you can have a nutritionist. So there's a lot of pieces, especially when it comes to healthcare, about what you can do. And I do like to bring up people in their 50s and 60s just because that is what the trend I'm noticing when I am talking to people. They're very like, oh, but they said I can do that. The doctor said I can do this. And that's what we should do. That's not always necessarily true. There's a lot of patients, people that I have worked with over the years that have been on a medication. Let's just kind of say an antidepressant. And I was talking to a patient and she was on it for like 20 years. So she's like, yeah, I just kept picking it up and I didn't really think to ask. So that is, in my medical professional opinion, a red flag, because how are we not asking if maybe you don't feel depressed? Maybe you feel better. You were medically stable and now you needed it for a certain time and now you're off of it. So and again, we can talk about antidepressants, but they do take a toll on the body eventually. So there is unfortunately, no screening when it comes to that provider. Like, oh, hey, Christina, you've been on antidepressant for 2 years. How have you been feeling? So when I talked to that patient, it didn't sound like her antidepressant was addressed. She just kept getting a refill. So really pay attention. I do encourage you guys, however old you are, maybe you're a parent and you're listening on here, or you have a loved one that could benefit from this. I would encourage you to go through your medicine cabinet, see what you're on. Am I on acyclovir for a viral reason? Am I on amoxicillin for a short period of time? Am I on famotidine for my reflux? And take note how long you've been doing that. Get a pen and paper, write down each medication, see when it was prescribed, how long have you been on it, do you feel like you're better? And then I would definitely address that with your provider or pediatrician the next time you do see that provider, and have that conversation. Hey, is this medication really necessary? Get a breakdown, because all medications, while we may not see side effects, not experience all side effects, every single medication does have a side effect. Sometimes we see them quicker than others. Sometimes they'll come up months later. So that is something that's going to be very good. And while doctors know all, they are not the end all be all. I always encourage my clients that I work with, anybody that I really talk to, is do your research on your own. Okay, because a lot of time I did speak with this lady. I went to Pilates, and I think she's in her late 60s. And her story, we just started chatting because I'll talk to anybody. So she was like, yeah, she wanted to buy eggs for me. That's how it started. She wanted to buy eggs for me. Then I was like, oh my, I've changed a lot of my lifestyle. You know, my doctor wanted to put me on a statin. I was like, oh yeah, statins, and I'm not the biggest fan of them. So she goes, yeah, I had, you know, she had some cancer cells somewhere. So basically, she changed how she lived her life. She changed her food all on her own. She did her own research, and she was like, I'm not going to take that. Let me try it on my own. So basically, what she did, she lost a lot of weight. She ended up having to have some surgery, and her cancer cells were like nowhere, very, very low, you know, nothing to be alarmed about. So then she goes, yeah, if it was up to all these doctors, they would put everybody on prescription medications, and they just want me on prescription medications. And I told her, I mean, you're not wrong. So then she goes, I'm the captain of my own ship. And I go, I love that. I go, yes, good for you. So that's a perfect example of somebody that has taken control of their health, had said no, and you can say no. You know, just because you have a prescription filled doesn't mean you have to have it. And again, I like to say medicate Western medicine has a time and a place for everything. We need it for psych stability, for if you feel like you're in danger, you're going to harm yourself. There is absolutely a place for that. But for the most part, we can do a lot of things a more natural, holistic way. So if obviously in your crisis, and you know, like my dad's situation, like he needed all the medications, he needed everything. And already in my head, I'm like, okay, well, he's gonna need to be on this supplement. And then so he at one point was getting feeds via a nasogastric tube that went through his nostril to his stomach. And I had asked the nurse, I'm like, hey, is there any organic feeds that we can get him? Because I'm thinking, okay, like what's in the ingredients in those feeds? I know because I've seen it in the hospital, they're not optimal. And she said, yes, we do have them. Like when he gets better, we can transition him to that. I said, oh, okay, good. So in my head, I was already thinking, you know, I'm like, I know he's going to have to be on medications and this is going to help him. But I was also thinking long term at the time, okay, you know, well, what else can I do for him supplement wise? My brain was just kind of already going to that. So that's just where my mind was at. So, but those are the things, like, again, we want to think about. When I did work in pediatric bone marrow transplants, we did have parents that would bring their own food. We had parents that would bring organic, like protein shakes because they weren't a fan of what they had there. So I would encourage you to do that too. If you have a loved one in the hospital, bring your own food. You're controlling the ingredients. Hospital food isn't always the best, and you know what you're feeding them. Obviously, you want to make sure that they're able to eat a regular diet because everybody in the hospital is going to be on different diets. So that is really kind of the biggest thing I have seen with prescription medications is just the ongoing slot of renewals and not really seeing if that patient needs them or that loved one needs them. So again, if you do have prescription medications in your house, check the expiration date, see like, oh man, I'm feeling better, you know, have that conversation with your provider, and make sure it's really something that you do need. And again, just coming prepared to ask those questions that you feel need to be addressed. And then, you know, just other conversations that I have with people, they're frustrated with their provider, and like I said, you can part ways with them. uh, there's lots of doctors out there, and don't feel like you're going to hurt their feelings, because they will, I'm sure, have somebody come and replace you. Just being that spokesperson is, I would say, the biggest driver. And we always can't just put blind trust in somebody, because that provider is a human being. The doctors that took care of my dad were human beings, and I know that I make mistakes all the time. So that's why I was very on top of everything in my dad's care, just to make sure nothing was missed. Because again, like, that's my father. I wanted, you know, to make sure everything was addressed. Okay, what about this lab? What are you guys doing? Are you guys titrating down, his blood pressure medication? It's just that is, I just can't convey enough how important it is for you guys to be involved in your healthcare. And if you haven't found a provider, a medical provider for you, there are actually a lot of providers that I've noticed going into a more self-pay program, like a concierge service, because then they're able to actually sit down with you, have a whole hour to discuss your medical history. A practice here locally where I live, they're actually transitioning to doing that, kind of like a self-pay. Again, insurance is billing, and that's like a whole other topic for a different day, but health insurances do kind of dictate how long providers have with one another. I've also heard from nurse practitioners and people that I know that if you have, like, let's say I'm going in, oh my gosh, I've had really bad reflux, that provider will address that. Oh, but I do have another question about this. Some people are like, hey, listen, you're going to have to make another appointment for that topic because we just don't have the time. And when it comes to your health, you want to make sure that they have the time to give you. And again, that you come prepared, even if they look annoyed, it doesn't matter. This is your health. This is your life. We only get one physical body to be in. It's important to stress to your provider, again, to be a collaborative team, right? So, your healthcare team, it could be a therapist, nutritionist, a holistic nutrition practitioner, it could be your gym trainer, it could be your masseuse. There's just so many things that are really just involved in our health that we have to pay attention to. And that, again, it's just a very, very important, and people don't do this enough, again, because they feel like they're gonna make somebody upset. And again, that's okay. If you're gonna make them mad, then it sounds like they are just not meant to be in your circle. So come prepared with your questions, write them down, do your research, and then come with even more questions. And again, making sure you're not feeling super rushed, because again, sometimes you're just waiting for that appointment to come. And then it's like, oh, okay, we got to go. And you're like, oh, wait, hold on a second. I forgot to ask you this. And then they're kind of just in their head, they're like, okay, well, I gotta go. I don't have time for this. So again, you want it to be a collaborative effort to set goals, to make sure your health is going in the trajectory, that you want to. And then once you collaborate with that provider, you're gonna have better outcomes because you guys are working together. You guys are collectively making goals for you, and also repeating instructions. Sometimes if you've had initial, let's say your child gets diagnosed with type 1 diabetes, your world is rocked. As a parent, you're overwhelmed. You got to check blood sugars. You need to get an insulin pump. You have to figure out snacks. And I think too, when a diagnosis like that happens, just like in my dad's case, he had a heart attack. We had no idea what was going to happen. Your central nervous system gets very overwhelmed and very overstimulated. So repeating instructions is even really important. Like, hey, okay, I just want to make sure I understand this. She has to take this medication at this time. I have to do it like this. I have to lug it like this, because you're trying to think of so many things, and you're really trying to understand how this diagnosis is going to shape your child's life. And just repeating those instructions is going to tell your brain, okay, this is really what we're remembering. And the same thing when it comes to your labs, ask about like what type of labs are being ordered. What does it mean? Oftentimes you can do this on your own. I know some people are using like AI to interpret labs. While that may be okay, it is still going to be best for your practitioner or your provider to help with those labs, because they are going to know your body and they are going to know your health. 1 second, sorry. I just saw. So again, that's going to be just another really big factor, because again, a lot of times people are like, oh, well, I don't know, what this means. I don't know. And that's very common. And then a lot of times too, so like I had a family member, they just had labs done. like either through Quest or LabCorp. So you're going to get your labs, but then you're going to be waiting for a little bit, or your provider may be like, hey, we got your blood work. This is kind of what's shown up. And then you can ask, okay, well, what does this mean? How does this work in my body? When I do blood work with my people, I do like to say it is collectively like everything affects one another. Think of it kind of like a domino effect. So when you get your blood work, make sure you're understanding that you understand what is happening in your body. And the more confident you get in like this with asking your provider questions, you're going to feel like, oh man, I can do this. And that confidence can just roll over into confidence in changing your nutrition, into because then at that point you are the captain of your ship, of your health ship. You're able to steer it because now you're able to advocate for yourself instead of like, oh my gosh, what do I do, carrying over and just obeying, like not questioning what's happening. Especially now in today's age, we need to question. um I can't say how important it really is. And again, it's also going to help, with prevent misunderstandings. Maybe the doctor said one thing and you're stressed out and you heard a different thing. So again, just repeating what you've heard is really going to help cement what has gone on, especially like with initial diagnosis. Again, central nervous system overload is a real thing. I have experienced it. My central nervous system is slowly starting to get better. Um, but again, just, addressing those like really important topics, and you'll be able to catch, little issues, right? Like, oh, well, like even the tiniest question can really benefit you a lot because it could be something really important. um I think that's really, I think, all I had, what I really wanted to say. And again, I'm saying this because again, I've seen this countless times. It doesn't seem to be getting better. I think people, especially after COVID happened, people are more aware of what's going on in their bodies, but not fully wanting to take responsibility for their health. And I'm a big believer, like we all have choices. Every day we have a choice. So I can either choose to fill my water, I can choose not to fill my water, I can choose to go to the gym, but it's your health, and it is at the end of the day, it's your responsibility to make sure that you are doing what you need to do. And while you can say, oh, but my doctor said this, my doctor said that. And like I said earlier, it's not the end all be all. You can still outsource something you don't want, if you don't want to do it, And again, I'm not saying don't say no to medical advice. That's not what I'm saying at all here. But find your voice and let it be heard and be confident in what you're saying. So I really hope this has helped you. I hope that you leave here feeling confident, leave here knowing that you're the captain of your own ship. You're in charge of your health. At the end of the day, your provider is working alongside you, your practitioner is working alongside you. And especially if you have little kids, that is really where we need a lot of advocacy when it comes to the health of our children, especially the elderly. I do see a lot of that when it comes to Parkinson's, dementia, and that caregiver is very overwhelmed. So make sure that you're taking care of yourself, that you're having self-care, that you cry if you need to cry. Release emotions is really important. So for those of you that missed, next month's masterclass is going to be about why don't we have coffee first? So I hope you guys join in for that. And again, I do a masterclass every single month. It's completely free here on YouTube. So then what happens is, if you guys want to rewatch this or be like, oh my gosh, my grandma is taking care of my grandfather, I should send this to her. I think it'll come, like it'll be on my channel tomorrow. So you can share that link with whoever you want to. And I'm here spreading education. I'm here spreading awareness about things that I have seen throughout my duration working in healthcare. That is really a big reason why I've shifted to the holistic realm of healthcare as a holistic practitioner. And if you feel that you are struggling with your health and you're not moving the needle and you're like, my doctor doesn't hear me, my labs are normal, and but something is off, feel free to reach out to me. I'm here to serve. I am just very blessed and honored that God has called me to do this, has placed it on my heart, and I don't take this lightly, especially after my dad's passing. It really does change how you view health, and I just may do a masterclass on grief. It's a very, it's a very, I don't even know how to describe it. It's a very awful thing to go through in life that we are all going to eventually go through. And it's very complex, but beautiful and very painful at the same time. So, so like I said, the next month will be on coffee. Why not to have it first thing in the morning? And you can always reach out to me if you want to chat. I will leave my email here for you all. But I don't charge or anything like that, like just to talk. Like we can just have a conversation and, just to get to know you a little bit better, get to know I do work with kids, I work with adults, I work with males, females, I work with anybody that has a pulse and is ready to get their health back. Because like I said, we have one body. Let's be good stewards of it. And I'm just reading the comment. Oh, you're welcome, Joelle. um, so anyways, does anybody have any questions before we head off? Let me do that first. If you don't have any questions, I'll just wait because I know sometimes typing can take a little bit to do. I usually post, so I will put, if you follow me on Facebook, it's Christina Moreira, just my name. And on the events page, you'll be able to see like the events, the masterclass that I'll post. So I will post, I'll probably do it like toward around the same time next month. And I really just try to get it out there. I really do 7 o'clock. That way people are either done with dinner or they're just wrapping up with dinner. And maybe I'll do it on a Sunday just because life is kind of busy that month for us. But anyways, oh yes, share share away. Let's get people healthy. Let's get people in charge of their health. Let's get people to really understand the importance of speaking up for yourself, because if you don't, there can be some repercussions. There can be a medication you're not supposed to be on. There you may not need it. I just really, again, I really encourage you all to really understand and connect with your body in regards to, like, if you eat a certain meal, let's say you have gluten, you have dairy, oh my gosh, I'm so bloated. Maybe don't eat that. It's going to cause not just gut inflammation, but it also can be causing some also internal inflammation. If you've gone through a massive trauma, you're going through grief, your central nervous system is going to be extremely sensitive. I still sometimes cannot stand loud noises. I will tell my family, please lower it down. So I think I might do what do you call it? A masterclass on grief. I don't think that grief is talked about. I've been very open with my grief because it is a very lonely journey. And I just want you guys to know that you're not alone if you're going through that, whether it's grief, whether it is a divided family. Grief doesn't necessarily have to be the loss of a loved one. It can be divorce. It can be issues with children, not speaking to them. There's lots of things that we do grieve. A loss of a pet. My dog is usually in here, but he's downstairs. So again, I just thank you guys. I thank you for your time. Thank you for sharing your time with me. I really do love what I do. So if you guys need anything, please don't hesitate to reach out to me. I love you all so much. And I thank you for being here. You guys have a beautiful evening and eat healthy. Bye.